To everyone, we will send out this recording so that you have it, and then we'll also plan to review um, highlights to everyone and review any slides with you guys in your individual community meetings as they come up. But thank you guys so much for joining today. Just for everyone's benefit, um, I see that Catherine Noyes from Northlet is on, Georgiana Causey and Mayor David Streeter from Hamburg are on. And then we have Dr. Jennifer Connor and Yoshara Barber from NYIT, and then Jalen and I from Winrock are on. Um, so as we go throughout this presentation, if you have questions, feel free to put them in the chat as we go. Jen and Yoshara, I know, have some points along the way for questions and input too, so feel free to come off of mute if there's anything that you want to ask clarification or talk with the group more about. That's completely fine. But Jen and Yoshara, I'll turn it over to you guys now and put myself on mute.
Okay. Well, my name is Yoshara Barber. I have not had the pleasure of meeting many of you guys. I serve as the Regional Program Director with Delta Population Health Institute and New York Institute of Technology. I will be assisting Dr. Jennifer Connor with the technical assistance of this grant. And I am just excited to be here and take some notes and to get to learn more about you guys as well.
And thank you, Yashara. So as she said, my name is Dr. Jennifer Connor. I know I've met most of you on the call. I have done this presentation for a couple of communities, but we thought it'd be just a good idea to have this archived. And so I'm not going to come off camera so that I can see my screen. And but as Jordan mentioned, if you have questions, we'll take those in the chat or at the very end. And we'll probably stop along the way for some interactive discussion. So the title of this presentation is Cultivating a Culture of Health Through Policy, System, and Environment Change. You'll hear me say PSE a lot. We basically want communities to think about not just making one of these particular changes, but how then do we think about sustainability through policy change or system thinking or system change to create, again, long-lasting effects. So again, I'm with the Delta Population Health Institute at NYIT-COM at Arkansas State University. So we can go ahead and next slide. It's not hard for us to think about some of the challenges that most of our rural areas face. If you see the Wordle here on the screen, I bet some of these resonate with each of you. We do struggle, again, as rural communities and urban communities alike, with some of the issues that you see here on the screen. Lack of transportation, quality of place, employment issues, workforce shortage, food deserts, recruitment and retention of our workforce, broadband and or the limited broadband and workforce shortage. So again, I'm not going to belabor, but many of you again on the call and watching this will know that these are real issues and they're very complex, and we have to sort of peel the onion, so to speak, of thinking about, you know, what are those policy systems and environment change? What are those solutions that we can put in place that tackle these very complex issues? Next slide. So I'll talk a little bit about, and you've heard me say, social determinants of health, SDOH. So when we think about health, again, we just defined it in terms of not only food deserts, but also lack of transportation. And so a way to think about health is in like its most broadest definition. And in doing so, again, that's the social determinants of health model. Basically says we have to environmentally, we have to think about those social and cultural contexts. We have to think about what is our education system and what is our economic viability. And all of this really put together is how our group defines health and culture of health. So when we think about a lot of the solutions that we want to help you guys implement, it is really thinking in health in its broadest terms. So next slide. So today we'll again be talking about a couple of frameworks that we've been using along the Delta region to think and to cultivate this culture of health. Again, you heard me say earlier, what is this PSE? What does it look like? What does it mean? And then how do we combine that with the programs and the boots on the ground efforts that we have to create this long-term positive community change? And so we'll look at some of the innovative strategies and some of the lessons learned, and then look at a little bit of the success stories and next steps as we think about improving our population health. Next slide. And so again, this is just sort of an iconic representation of what we're trying to say, that we have to think about rural and community economic development. And that's where Rinrock really comes in as our partners to say, what does our downtown look like? What does our park space look like? What does our storefronts? Do we have dilapidated buildings that are falling in and crumbling? And then what is our public and community health infrastructure? And I think we learned through COVID, how important it is maybe to have a community health task force. How are we going to, connect all of our assets that we have? And really this clinical community linkage. And that is that we know that, health is also defined by our individual behaviors and our genetics and other environmental things. And so we have to really think about how we bring our clinical partners, and so our clinics, our pharmacies, people that are providing those true healthcare services with the communities, and so our farmers markets, and how do we make those linkages, and then all of this really confluencing together to create a culture of health. Next slide. So this is a model that Jordan and I have created over time with a lot of our experience. And it's really this community improvement concept. And it's because we think a lot, and you can kind of see it here, in silos. We think and work oftentimes in silos. And so our health and healthcare systems are over here, and our education system is over here. And potentially we include the arts sometimes in what we do, maybe not. And then again, why is tourism in this health improvement model? Well, it's important that, again, we work across sectors and really build these collaborations and really think about, how do we bring healthcare, education in our environment, arts and agriculture, transportation and tourism all together when we're planning our community improvement projects. And so again, you'll just see a lot of frameworks in this presentation and a lot of geographic and iconic representations of really trying to get you to think about, again, health in its broadest terms. So we call this the HEAT model. And so as we're working through the technical assistance with communities, we really say, okay, great, you might need, update your hospital, but then, how far is your hospital from your walkability score from downtown? And if you're putting in a farmer's market, what is the agricultural landscape? Because in this, in the Delta, we do a lot of row crops and not specialty crops. And so are we going to have enough vendors? And so there's just ways to think about solutions that we do, place-based solutions that really encompass this sort of HEAT concept. Next slide. And so as I know we have a mayor on the phone here. And so really, we talk about culture of health, but at the end of the day, we're really talking about resiliency. And so community resiliency, and this is where that intersectionality with community and economic development comes in. We can have the best places and spaces and quality of life, but really to look at the building blocks of our community, we've got to have that workforce. We've got to have some sort of generating economy. We need to look at revitalization and innovation. Obviously, we have changing technology. And I think last but not least, disaster recovery. As we're seeing high temperatures, as we're seeing 500-year floods, as we're seeing pandemics, disaster now can be defined in a lot of ways. I know we think a lot in terms of, tornadoes or those, wildfires, for instance, as a disaster recovery. But I think the pandemic showed us that we can also have bio disasters. And so how do we think about, for instance, if we have a shelter and we do have a disaster and we're in this space and place where we need 6 feet apart from cots or from volunteers, that posed a different kind of question in disaster recovery during the pandemic than we had ever thought about before. So again, while we are talking about health and healthcare and improving chronic disease, we're also talking about resiliency. And that's super important, a message, because a lot of the times people are like, health, that's way over there. That's not, health and wealth, that's over there. That's not my responsibility. That, again, in that silo model, but everybody can understand the need for a resilient community. Next slide. So I talked a little bit about clinical community linkages and why it's important for us to think about health in sort of our genetics and our disease processes, and in our provider context. So again, our APNs, our nurse practitioners, our doctors, but also again how that relates to our community. So if I'm diabetic, for instance, and I don't have, and I'm living in a food desert, but don't have the opportunity to buy healthier foods to support my diabetic condition, then I don't have a clinical community linkage. And so I just put up on the screen here some different projects and programs and policy systems and environment change solutions that we've tried along the way. And so I'll start with the far left. You saw agriculture as part of our heat model. It is super important to remember our agricultural community, not only for the food systems and the contributions to economy that they have in our community, but also their health and wellness. And so we often know that farmers, our producers, are working from sun up to sundown. And so we have to think about how to do place-based solutions that meet them where they are. So we have tried very innovative models like joining our farmers at their PAT, so pesticide applicator training. We've thought about joining them on the farm. We've thought about, how do we put blood pressure monitors at the shops, so that farm workers can, monitor their blood pressure on a routine basis. And so, again, it's this concept that if you can't, if they can't come to you, how can you go to them in their environment? And I think it's, very important that we learned during the COVID-19 pandemic that telemedicine was a rapidly adapted technology that we were using. And so we did see an uptick of farmers that were able to do telemedicine visits from their tractor. And so that's that changing technology that we have to think about. We now have some of our researchers that are working on a podcast relative to our farming community that can be listened to from the tractor cab. And so we're super excited with some of the advancements we've made in the agricultural health community. I think it's also important to think about how we are engaging with our top employers and our our workforces in our communities. And so you see in the middle here, when the vaccines came out, we didn't expect people to come to us to get their vaccines. We were doing worksite wellness in the sense that we took vaccines and other health screenings to our factories and to our production plants. And again, it's this idea that oftentimes, if we have shift workers at our factories, perhaps clinical services are closed. And so how do we take, our services to the workplace such that it's convenient and there's a higher engagement in medical services? Some of the other strategies that we've had, you'll see there in the bottom is Senior Citizens Day. And so again, thinking about transportation and mobility issues, rather than having senior citizens trying to navigate, all the different services in the community. This is in DeQueen, Arkansas, where they come together one day a year on their square and not only celebrate with, music and crafts and vendors and other things, but also have all of the services available to senior citizens in the community, set up tabletops or booths so that senior citizens can understand what services are available. So it's a great way not only to celebrate the generational impact of that group, but also hope to connect them to resources within their community. Just kind of going along, some of the other things that we've done to try to create these clinical community linkages is working with our provider community to sort of prescribe exercise and diet. And so the Veggies RX program, the Parks RX program, the Walk with the Doc program, all of those are programs in which local providers can, again, prescribe food or healthier food or prescribe exercise. And so it's a great way to engage the, again, provider community, but also encourage just talking with the doctor outside of the clinic walls. And so if you've ever heard of the white coat syndrome, you know that when you walk in, you forget to tell your doctor everything it was that you needed to tell your doctor. And so if you're just sort of walking along a couple of days a week and you remember that you had joint pain yesterday, perhaps you'll be like, oh yeah, and then yesterday I had a little bit of joint pain. And that might not be something that's remembered, again, in the clinic walls, but it gives us opportunity to sort of think about how do you provide healthcare outside of the clinic walls. Double Up Food Bucks, you'll see there in the bottom, that's a program that we have where there is federal incentives to encourage uptake of healthier food items. And so if you are an EBT recipient, if you are engaged in the Double Up Food Bucks program or project, which we do have both grocery stores and farmers markets around the state of Arkansas who are engaged with this. If you, for instance, buy $5 worth of produce, then you actually receive $10 because there's a $5 voucher that can be turned in because of the you're buying fresh fruits and vegetables. And then kind of some of the other things that we had over here in McCrory, Arkansas, we instituted the warehouse that was part of their project. And then the grow trailer you see at the very top right corner there. The warehouse was kind of this idea that, we often have these one-day health fairs. And while those are definitely important to do screenings and provide the community with information, there's a continuity of care issue here in the sense that, if I screen diabetic or have a, high sugar glucose on this month, and I don't have a medical home, what do I do next month? And so this warehouse concept was that all of these vendors, you can see there, they did cooking demonstrations, they had pharmacy assistants, they had other kinds of screenings, and that all came together every single month. And that just provided some consistency, some continuity of care, and allowed providers, again, in the community to come and help resource patients that they had. So for instance, if I had a food insecurity that was screened, then I also had the food pantry there that I was able to just walk across the hall and do a referral. And so it's a kind of a one-stop shop, if you will, in the sense that if you have somebody with transportation issues or other social determinants of health issues, which I talked about earlier, then you're expecting your client or your consumer or your patient to go from point A to point B to point C to make all these resource referrals, where this model brought all the resource referrals under one roof. That was actually conducted in a city building. And so the city, took part of this process where they gave them the place and space to do that. The Grow trailer kind of grew out of the warehouse in the sense that they did have food distribution as part of the warehouse, and they literally had people walking from cotton plants. So if you can envision the heat right now, it's July, 108 degrees, walking 3 miles one way to come to the food distribution. That's, not a situation in which we want our clients and consumers and community members in. So the Grow trailer was established so that if food distribution came to McCrory, for example, then this trailer could be taken out to the smaller communities like Cotton Plant to do food distribution. And so, we are in a very rural state. And even though we have places like, Eudora and Hamburg, we do have some outlying communities that if you've, again, experienced transportation issues, getting just 3 miles up the road can prove troublesome. So the Grow trailer was an example of how we were trying to, again, to do place-based solutions where we were trying to offer not only food commodities or food distribution, but healthier food commodities and food distribution, such that, again, if I am a hypertensive patient and high blood pressure there, that I can, get some lower sodium foods. So those are just some examples of clinical community linkages. And I hope you can see how we're, again, trying to do policy, system, and environment change and bring all of that information together. One good model for that, you'll see right there in the middle, is Healing Hearts. And so that's, again, how can we think systematically with our healthcare system, our churches and faith-based systems, our community systems, and then involving our city municipal leaders in that as well. Next slide. And then I talked a lot about our public and community health infrastructure. I think it's super important to think about, the systems that we have in place and how do we connect all the dots per se. And so here are just some examples that we've done where we've tried to improve community health through public facilities such as schools, such as salons, such as churches, where we're really pulling in these entities to help that culture of health. And so on the far left, you'll see there, this was a program that we did called Million Hearts. This was to get people to increase aspirin use if appropriate, also to lower blood pressure, to screen for cholesterol. And if anybody knows, one of the most trusted sources in your community is your barber shops and beauty shops. And so we were very fortunate to work with about 10 barber and beauty shops in the South east corner of the state that allowed us to come and do lunch and learns and to put materials and information. And the stylists themselves, or the barbers themselves, actually went through a training, and so they could talk to clients or consumers. And so if Miss Jones said, I've just got this headache that won't go away, well, have you checked your blood pressure lately? Did you know headaches can be part of blood pressure management or blood pressure identification? And so certainly making sure that every sector and every business in your community, knows the signs and symptoms of chronic diseases and can really help educate your public. You'll see there in the middle, we also did Million Hearts at the library. We know in most small towns and rural towns and urban places as well, that the library is, a hub, if you will, especially if you don't have computers or you're taking classes online or you need the internet, that libraries can be a valuable resource in the community. And so we worked with librarians as part of the Southeast Arkansas branch. We had about 4 libraries participate. And so we were able to do 12 activities in the library that really created, and we do have videos and testimonies if your library is interested, with ways in which they implemented the Million Hearts library activities. Down at the bottom there, you'll see that we also were able to place blood pressure monitors into grocery stores. Many of us don't have a Walmart or a Walgreens that has a consistently available blood pressure monitor. And so we worked with the Arkansas Department of Health, the Arkansas Minority Health Commission, and we were able to put these public blood pressure monitors. But think about your own community. And if I don't have a home monitor, but that's part of my blood pressure management, where might be a place that you could put these blood pressure monitors such that they're frequently visited entities, and it allows the person to engage in their health. Moving along in this slide, you'll see we've worked a lot with schools to do community gardens and school gardens. We know that, again, we're mostly a row crop production area, and so how then do we use our assets that we have to increase production of fruits and vegetables? And so school gardens are, for the most part, a great solution, because we do have kiddos in school for a majority. There's always the implementation of who's going to look after the garden over the summer. But for the most part, if you can do some intergenerational gardening, where maybe some of your volunteers in your community go out to the school during the summer to keep it going, is important. Or working with programs like 4-H or FFA or others who, even though it's a school-based program, that they do have activities year-round. We know that school gardens are a great way to help increase fruit and vegetable production. Lastly, here down at the bottom, we again can't forget our faith-based sector, and this is really where we have programs like Faithful Families or the Bless Your Heart Toolkit, where it's working with churches to make them healthier environments. And so it's everything from a water policy, meaning if you have potluck or Sunday school or some function, that if you have, tea and punch available, that you also have water. It's not to say that people have to take away something. None of our programs here are about taking, rights or benefits away. It's about choices and alternatives. And so the water policy just says, hey, we're going to make sure that there's, a pitcher of water out during our, potlucks. So the choice for a healthier option is there. And I just threw this picture on the right there. Again, this is more that place-based strategy. So when COVID-19 hit, we do know we had some very remote and rural areas that didn't have access to either testing or vaccines. And so we do have the Delta Caravan as part of the NYIT COM. There are other mobile units around the state of Arkansas as well. But this is, again, the strategy that, we can't expect people to always come, to a city or a community to engage. So oftentimes we have to think about what is the innovation of going to folks. And so you can see again in the middle picture there, that's an agricultural farm that had a COVID-19 exposure. So we took our testing materials to the farm and literally set up in the dirt to make sure that the services were available to the folks most in need. And so I encourage everyone in the communities that are participating as far as CLEAR, to reach out and say, if we don't have the service available, what mobile services or what outreach services can we bring to our community to make sure that we're meeting those most in need. Next slide. That was kind of the programmatic side, and on the policy side, there are definitely ways to improve public and community health. I've just thrown a couple up here, again, thinking about smarter lunchrooms. This actually happened in our colleagues over in Hamburg, but also in Macquarie, where we took on the smarter lunchroom movement. And so this is a way to get healthier salad bars in schools. And so again, creating that option for children to have, healthier food items as opposed to just what's offered as part of the standard cafeteria lunch. And so there's some policies that have to be passed by, the school board or administration. And then there's implementation, of course, that has to happen at the cafeteria level. But the smarter lunchroom movement is certainly a great way, especially if we think about the introduction of fruits and vegetables at a very young age, is super important to develop that desire and taste as an adult. At the bottom there, you'll see a program called Eat Smart in the Parks. This is a program that came out of Missouri Cooperative Extension. We actually experienced this in Lake Village, Arkansas. I had a mom come up to me that said, look, I have 3 kids. I'm here from, 5 o'clock till 9 o'clock, and you have a no outside food policy, and all you have is hot dogs and nachos. And I can't, give my kids that 2 to 3 nights a week. And so she just begged, are there some healthier food options that we can think about, and or can we think about the no outside food policy? Now, the outside food policy is important because that is an offset of offering scholarships. So if you think about this balloon, if you push in one way, it pushes out the other. And so the outside food policy and cooler policy was really established to help offset cost, programmatic cost for low-income families, but it did, of course, that policy had an implication of, potentially less food, not having good food items in the park. So Eat Smart in the Parks is an option. Again, it's not to take away any of that, but it's to say, how can we implement healthier food options in our park system, especially if you've got an offset, a financial offset policy such as no outside food. It's a great program. We've done it in a couple of cities, and actually our state parks adopted the Eat Smart in the Park program a couple of years ago. So if you have any interest in that, I think that's a great way. There are some a little bit of programmatic cost if you don't have the right refrigeration, or prep area for like frozen grapes, for example, which sell really well. But it is a potentially low cost solution for getting healthier foods into your parks. Just sort of moving along the screen, you'll see that we have access to and can help any community who's wishing to do a HEAL resolution. So HEAL stands for Healthy Eating, Active Living. It basically is, a resolution for your city to adopt that says, we will consider health and wellness in all the work that we do, and that we will, engage in that kind of systems thinking when we pass our policies. And so it is a great way for cities to take a stance on creating that culture of health. And again, all those resources are available if any communities want to really pursue and adopt and see what it means to adopt a HEAL resolution. As with any resolution, we always try to make it a public affirmation or a public announcement. And so you'll see here the cities of Dermot, Eudora, and Lake Village came together as an entire county and adopted HEAL resolutions in each of those 3 communities, and really worked with the judge there in the top picture to think about, how do you make a more attractive community by being a healthier quality of place. So it's a great strategy to make those higher level system and policy changes. It also gives political cover if you're thinking about going for recreational grants or outdoor trail grants, because it shows your commitment as a city and a city council or a county and commissioners to be able to, make health a priority. And just moving along, we have an example out of Camden that established the HOPE Commission, the Healthy Outcomes and Positive Effects. So this is, as far as we know, in the state of Arkansas, the first local health policy board. This was appointed membership by the county judge and the mayor, where there was an actual commission looking at the health and wellness of the community. They were very instrumental, and you can see they're getting the city of Camden Bicycle Master Ped Plan. They've really worked on their greenway space, and they've created the Trace, which is their Rails to Trails project. So, if potentially, just like you have the Parks and Rec division, you might have a health commission or a health division, where you're really thinking about what is the overall health and wellness of your community. We do have programs here like Health and All Policy and Food Policy Councils. Those are really technical assistance books that are available to you to help you think through, if you establish a policy council, what are some of the policy strategies that you can take? Food policy councils are pretty interesting. Again, they're looking at everything from How many fast food restaurants do we have in a certain square mileage, to what is our, what could be some of the strategies for waste. And so if we've got restaurants or other entities that have food waste, how can we work together with like the Department of Health or a senior center and think about food waste that's perfectly good food that literally just gets tossed out of the door when we have, senior hunger problems, childhood hunger problems. And so it's a policy council that can literally take best efforts and strategies from other places and put that into action into your community. So those are just, again, examples of public and community health partnerships at the more policy level. Next slide. Okay. So I probably don't have to talk through this slide much because, again, this is our role in community and economic development. And if we were in person right now, I would bet I'd see a lot of head shaking if I said, hey, do you have any of these in your community? And this is the part where, again, we think about our infrastructure and how it really contributes to our overall health. And so, as I mentioned earlier, we do have almost every rural community I've visited. We've got crumbling infrastructure. So storefronts like the one on the far left that are just, vacated or burned out or falling in, or vacant landowners or landlords like we've got here in the middle. And then if we were to do a sidewalk audit, what kind of conditions are our sidewalks in? And that could be everything from crumbling, like the far left picture that was taken here in Jonesboro, or, the far right picture that was taken in Southeast Arkansas, where there is, grass growing. And so if you think about it, this is not just for exercise, but if I'm in a wheelchair, or I'm a mom with a stroller, or I have mobility issues and have a cane, what is the viability of these sidewalks and trying to get me from point A to point B in a safe manner? And so we have to think about, again, environment, the PSE, the environment piece of this, and not just in terms of our air quality and water quality, which is a lot of times what we think about, but really our built environment. And so I always use the example there right in the middle. You can see the yellow circle. So here's somebody, trying to better their health by getting out to run, but there's no sidewalks on either side, and there's two approaching vehicles. And so the safety of that exercise, is not very good and may, in fact, impose a risk that outweighs the benefits of exercise. And so, if you build it, will they come? We have to think about, how do we improve our quality of place and space such that if we are going to promote a culture of health, we can do it in a very safe manner. So next slide. And I always, just if I'm talking about rural and community and economic development, and I, talk about our built environment, it's always important to talk also about our economic infrastructure. And so we know the traditional three-legged stool of community and economic development means that, we not only have to retain the businesses that we have and think about expansion options, but how do we recruit? So how are we going to get, the best of the best and the brightest to come to our community? And I'll tell you, many surveys now are showing that, this younger generation is willing to take a pay cut if, in fact, they have a great community to live, where they've got vibrant places and spaces to have, a good quality of life. And if we think about what the pandemic did, it certainly opened up the opportunity for remote working. And so communities now have to think slightly different on their priorities, because we've now just, created a culture on the business side to recruit in different ways because they can work from rural Arkansas, so to speak. And so, again, you'll see environment down on the bottom. I've talked a lot about, how does our physical place and aesthetically, what does it look like? And how does all of that come together with health and wealth? And then I'd be remiss if I didn't talk about broadband. This is from Connect Arkansas. This is a couple of, well, actually, it's probably by now 8 to 10 years old. Maybe 7 to 8 years old, but I vow to say that it's not much different. And I think that the COVID-19 pandemic was the first time that we had a crisis that affected our education, our economy, and our health. So we couldn't do telemedicine because there was no broadband. We couldn't do online retail because there was no broadband. And that's shifting to online retail, for example. Or we couldn't do education, and that's virtual learning because we didn't have it. So certainly we're seeing more money go into broadband, and for the first time there's a conversation around health, because again, telemedicine was approved by the Centers for Medicare and Medicaid and reimbursed. That's important, reimbursed at the same level, because we've had telemedicine technology around for a really long time, but it's never been reimbursed at the highest level. So providers didn't really do it. And so now we're starting to see shifts and policy changes on the reimbursement side. So now we have to make sure that the access is there. So if providers are now willing to engage in telemedicine, we definitely need the broadband to be able to do it. So again, I put all this up here because it's super important to think about rural and economic development and the intersectionality with health. And again, to break down those silos as we talk about community and economic development in terms of buildings or industrial parks, but also think about it in terms of technology and park space. Next slide. So how do you get from sort of point A to point B, and how do you start thinking about all of this? And I show this slide, and I think it's super important because there's a lot of assets that communities have that are either not known about or underutilized, or just with a small amount of investment could be repurposed. And so part of the first steps that we do, you'll see here in the top corner, this was in Clarendon. The far picture is over in Helena, the bottom picture in Lake Village, McCrory in the middle there. We really just started to have, crucial and candid conversations about where are sidewalks, where are assets. And so this is a form of asset mapping, which will be one of the lectures or sessions that I also record a little later. But it really gets you to start thinking about, how do we connect things? What do we have that exists already? And what are the assets that we have? Like maybe the pink dots, for example, are, great assets that we have. And the yellow dots are, hey, if we just repurposed or reconnected or connected these dots, they would be super important. But it's also a visual representation. And so you can see there in the middle map, we've got a lot of clustering in one side, a lot of clustering in another side, but like this vacancy in the middle. And so sometimes those vacancies are fine, nobody lives there, but sometimes those are high residential or high areas that if we could just connect point A to point B, if I did have social determinant of health problems like transportation or mobility problems, then I could actually use all of these resources within my community. So it's a super important step when you're thinking about how, again, to do community improvement, to take the time to do this asset mapping, because a lot of things, as we know, sometimes they've been there forever. They're right up under our nose. Some people know about them, some people don't. But when we do this visual, exercise, it really illuminates some work that can be done. Next slide. So again, how do we, we can do all of the policy systems and environment change, but how do we shift? How do we shift a mindset? How do we shift a culture? How do we get the next generation to think differently because they're our next leaders. Well, some of the examples that we have here are just, again, more attributes to how you can do these things to help start making those changes in mindset to ultimately make change and change generational effect. So on the far left here, one of the strategies that we often use is pop-ups. So if you're in a community and you say, you know what, that's great, but it would never be viable, then have it as a pop-up. They're super important. They've been shown to be very effective. And so you can always do a pop-up farmers market or a pop-up smoothie shop. And you'll see there we did a pop-up bicycle shop. So again, if we're thinking about cycling or bike trails or trails as part of the infrastructure changes that we want to do, you know, maybe I have a bike that's had a flat tire for the last 10 years and I don't really know how to change it, or I keep airing it up and it keeps going back down. So we popped up a bicycle shop, and it was amazing actually how many people brought their bikes to be able to be fixed. And it's not something that, again, is a viable business every day of the week, but maybe one Saturday a month, a pop-up bicycle shop is something that is viable in your community. And so going now to the far left side, one of the issues that we had in Clarendon was we had this awkward intersection that often got sped through that was right in front of a school. So if you're thinking about safe routes to school, one of the pop-ups that we did was a roundabout. Now, if I, again, was in person with you guys, I'd probably see some frowns. Roundabouts are not, you know, something that we typically use in our Southern Arkansas region or Arkansas in general. And most people don't like them. They say, I don't know how to use them. But roundabout, in this particular example, was about the only choice we had engineering wise to be able to slow traffic down. The band room or the band trailer was literally across the street. So multiple times a day, children were crossing the street. So it wasn't just important in terms of, you know, drop off and pick up, but there was an active roadway that was used for educational purposes. And so I have lots of stories about this roundabout that I just don't have time to share today, but super important. And it really made the community think about not necessarily putting in a roundabout, but why was there a need to slow down traffic in front of the school? In the lower bottom, there is, again, some resources that we have available that talk about the integration of art and health and wellness. And so you can see here, one of the many assets that we have in South Arkansas are these grain bins, or silos as they're sometimes called. Old school, call them grain bins, I guess. But this was an endeavor that was taken up in Iowa, sometimes Minnesota. It's kind of common in the Midwest, where they created a tourism trail, and they engaged local artists. And so it's a great way to depict the culture of a community, but also to generate tourism and to really, in one of the examples that we have at a Worm Farm Institute, is a lot of people didn't know how food was grown. And so they used a series of these grain bins to really talk about the process of growing food. And lastly, right there in the middle, I have the Lakeside Learning Collaborative. So again, this was the mayor of Lake Village who really took it upon herself to establish a establish a learning collaborative. So the students here, you can see from the STEM class engaged with the mayor in doing a walk audit. So kind of on the last slide, I mentioned, you know, walkability assessment and a walk audit. Seeing it from the eyes of a student or a youth is super important. They see things that we don't see. Mainly, one of the things I was surprised about was trash. They were like, well, we got to pick all this up. And so while I was more focused on curb cuts, you know, and grass in the sidewalk, to them aesthetically, they actually picked up on the trash more than and litter more than I did. So again, it's a different mindset and a different thinking from a different generation, and what they believe, even though they had their little clipboards and were definitely writing down, you know, all of the infrastructure, but they also were looking at it aesthetically. So super great example there of how a second set of eyes can bring to light issues in your community. Keep going. The next slide. And then I just wanted to, I think I'm close to finishing here, just talk about planning and transformation. So all of this doesn't happen overnight. I'd be super remiss if I didn't say this is, these communities that we've been working in have taken, 3 to 5 to sometimes 10 years to get to a full shift in a culture of health. But some innovative strategies that we've talked about in bringing that tourism piece or that economic development piece into some of the overall and community improvement is we worked with Helena. Again, Helena is by indicators one of our poorest towns and has the worst health indicators, and so they've really taken to cycling as part of their both tourism and their infrastructure change. And so you can see here they adopted the Bike to Your Park Day. They've established 2 rides that now have upwards to 300 to 500 riders that come in, the Country Twitty bike ride and the Tour de Delta. Again, drawing on that heritage of music in their area, but incorporating health into that. And they've done pump tracks. You can see at the bottom, they've built pump tracks at their boys and girls clubs. And so they're really trying to not only bring in tourism and adult opportunities, but get children into cycling at a young age. On the right here, you'll see Macquarie. Again, they focused a lot on their foods, and so they did a culinary commercial kitchen, and so there's lots of always good cooks and opportunity for food development, economic development in your community. And so if you do have a place or space, commercial kitchens or what we call community kitchens are a viable opportunity to bring in food entrepreneurship. I do a program where I said, a lot of people didn't even know that, or a lot of young children didn't even know that being a chef was an occupation. And so how then are you again thinking about the next generation of workforce where you're training up students to understand that, yes, you can play with food and get paid for it. And you'll see there that they engaged the local high school. They wanted to adapt a farmer's market into their area. And so they had a contest out of the high school for them to create a logo. So they came up with this logo here you see on the bottom, and they branded it across their community with banners and with pop-up tents. And so that's how they established their farmers market. Next slide. All right. And then again, some easier strategies to think through and more pop-ups are if you've ever heard of parklets or pop-up parks or pocket parks. This is an example in Lake Village where you saw earlier one of those burnout spaces in downtown, and so we converted that to a pocket park. This is a place where they can have gatherings, play games, or just have a picnic in the middle of the park. And then one of the beautification strategies that we chose through the Lakeside Learning Collaborative that I mentioned earlier, which was the school city collaborative, is you'll see there that we have a shop and an agricultural department at our high school. And they grow beautiful flowers. And so we worked with our Chamber of Commerce and our downtown economic development. And so there were planters put outside of our businesses, and the plants were donated and grown by the local high school. So you see there, it says the little beaver, that's the Lakeside Beavers, and it says grown and donated by the Lakeside High School. And so again, students were able to come down and transplant, if you will, the ivies and the other plants that they were able to do. And we try to incorporate edible landscaping. So it's a great way to beautify your downtown, but also engage the youth as part of that structure. And then you'll just see that sometimes paint goes a long way. The mural there, it says "We Love Lake Village." Again, we were trying to aesthetically say, you know, what are some ways that we can improve the assets that we have. So this is an amphitheater that we have, and we created a selfie station, if you will, with our We Love Lake Village. And so we were trying to, again, incorporate tourism. There's a walking trail in front of it. And so we saw that walking sort of went up because people wanted to see the mural, and we're using the walking trail more. And lastly, down in the corner, if you've never heard of Crosswalk Art, this is an example of where you can do a policy system environment change where you're adapting a complete streets policy. The complete streets meaning there are appropriate crosswalks and signage for pedestrians, but you're incorporating the arts. It's not your traditional crosswalk. It is a painted mural of some sort that can represent the community, and also it improves aesthetically your downtown area. So Crosswalk Art is a great example where we're bringing multi-sectors together to address a community problem. Next slide. And here are just some examples of what that built environment looks like. So I'm not going to go through all of these, but again, sidewalks are super important. I'll just mention here, this is an ADA, at the very bottom is an ADA accessible ramp. So we have this beautiful lake, this beautiful three-quarters of a mile, I guess you will, trail. It was right across the street from a senior center, yet it had no ADA accessibility to get down there, and the only other ramp to it was gravel. So the city, because of the hill resolution, was really looking at accessibility and put in this ADA ramp. Just like Helena, you can see here that this is a little pump track. So if you have a little space and you don't know what to do with it and it's not viable for a lot of things, some dirt being moved around is a great way to build up a pump track. Some other strategies, again, the community gardens, the outdoor fitness stations. So if you don't have a gym, or if you have a gym but that perhaps doesn't have a daycare, or it's not accessible at certain hours of the day, then outdoor fitness stations are another great strategy, again, that you can incorporate into your park system. Right now at 108 degrees, I wouldn't recommend anybody go and touch these bars, but it is something that allows through our mild winter months in the southern Arkansas region to be able to engage in physical activity. Again, thinking through your assets, the community of Lake Village did the Mississippi River Marathon, and so it brings in about 1,000 runners and spectators every year. And so it was, again, taking an asset that was available and just putting a program around it. It is a charity event where that does go back into our school systems and our local nonprofits. So again, great way to incorporate exercise, use an asset, and then put the money back into the community. Next slide. All right. So I often get asked, you do all this work, you try to create a mind shift and a set of thinking that's a little bit different, but does it really matter? Well, yes, it matters. And you can see here that in 2019, the Robert Wood Johnson Foundation actually recognized the city of Lake Village, the work that they were doing, and they were a Culture of Health finalist. And so I say all this to say, keep doing the work. It is very, or it can be very time consuming. It can be a lot of lifts for a lot of people, but certainly it is worth it. And we do see indicators of jobs, indicators of A1Cs being controlled, and other things go as part of these initiatives. And so this is the Culture of Health framework. It basically says you've got to share the vision across the entire community. Those cross-sector collaborations are super important. You have to consider equity. I mentioned on the map earlier, we had assets on one side of the community, assets on the other, and no connectivity between the two. So how are we thinking about equity and healthier communities in that sense? And then integrating, again, those public health systems and healthcare systems. And so I hope this is all important to say. Keep doing the good work that you're doing. It does over time create this mind shift. And it's really hard sometimes to keep the vision either on the same path or to share that vision where people are really buying in. But those are super important if you want improved population health and equity to be your outcome. Next slide. And so these are food for thoughts. I, again, am not going to go through this, but this is just, again, sort of homework for you to think about. We do know that there's real challenges, but we know that there's also some potential solutions. And so, again, I've just put some information here about thinking through those technical assistance programs for asset mapping, about thinking how we do those public-private partnerships, about thinking about our workforce and implementing wellness programs that look at a total worker health. So not just the safety of the factory, but the wellness of the factory. And I mentioned earlier, how are we going to adopt telemedicine? How are we going to, put broadband as one of our, as one of our forefronts of infrastructure development. And so again, I encourage you to sort of read through this list, think about it in the context of your community, and then how could you work to adapt some of the solutions for these challenges. Next slide. And I mentioned it before, but also thinking through what your disaster preparedness and recovery looks like in terms of community resiliency. So again, none of us thought about volunteer safety at 6 feet apart before COVID-19, but now we know COVID-19 is and can be a potential threat to our communities. So how are we thinking differently about disaster preparedness in light of pandemics, in light of heightened climate change and those kinds of things? And so again, more food for thought as homework to say, how are we doing these, how would we do a local health policy board that was kind of mentioned before, and how would we think about policy system and environment change if we were going to create a culture of health? Next slide. All right. And so again, these are questions for you. And you can use them as talking points for your community. You can use them as interactive discussion with maybe leaders or other, faith-based leaders. And they think of it, it challenges you to think about, for example, how did the pandemic highlight major health disparities in your area? Were there folks that never had food insecurity that all of a sudden experience food insecurity, and were you prepared? Did they know where the food banks were? Were your food banks full of volunteers that were 65 plus and were not able to volunteer during the COVID-19 pandemic? And did you have a backup plan for that? So again, just like with the kind of 2 slides before, or kind of your thought provoking, and then here's some actual questions on this slide and the next slide that can help you talk to community members about some of this important policy system and environment change. I think if you go to the next slide, Jordan, that's just more questions. Okay. Again, in terms of community and economic development, in terms of public health infrastructure. So I, again, encourage you to use these as talking points about, what are some of the resiliency issues that you're facing, and how could you engage community and economic development work? And what policies do you need either on the books or at the state level as advocates in your area to improve activities? Okay. And I believe that's it, Jordan. Yep. And I always, if you've seen my presentations before, I always end with this, one of my favorite quotes. It says, I haven't failed, I've just found 10,000 ways that didn't work. So not every strategy or program that I've mentioned in this session will work for your community. Oftentimes I've been told that'll never work, or we've tried that and it failed. And I would just encourage you that, times change, leaders come and go. It might be a different awakening. So the pandemic, again, awakened us to telecommuting and working remotely. So just because it fell before, there might have been a sentinel event that changed it. I encourage you, don't think of it as a failure, just thinking of it a way that didn't work and you're trying something new in your community. And with that, I'll conclude. And I believe on the next slide is my information. That's my personal cell phone number, 501-247-8443. So if you have any questions, myself and Yashara will be available to answer. That's also my email. So I encourage you to think about the questions, think about the solutions, kind of go back over the slides. And if there's any of the manuals or programs that you're interested in, just let us know. And I'll
Jen.
Yep, turn it back to Jordan.
Yeah, thank you. And community leaders, again, we'll follow up with you guys and those either from your teams or some of the other communities that weren't able to be on today. And we can, in more detail, discuss some of the questions that you had, but please do reach out to Jen or Yoshara as needed. They are great resources and are available to you through this project. I know we are a little bit over time, but I wanted to just see if anyone had any burning questions, immediate comments, thoughts, feedback before we conclude today. Okay, I don't see any, but again, this isn't the last time to ask a question or say anything. Let us know. Our next training will be Tuesday, August 16th. We are meeting in a every other week fashion, but we will not be meeting the week of August 2nd. Jalen will send out a reminder, excuse me, just like this week. Sorry, that will have the meeting link and the topic that we're going over. But it will be similar to this format. The topic will be on mind mapping for community capitals, which again, I think some of you have gone through this training, some of you haven't. But it's also meant to be a time that we can learn from other people. And with that, Catherine, I see you have your hand raised.
Well, we can't applaud, so I just wanted to say thank you all for your hard work and dedication. It's probably a little strange sitting there time after time and not being able to see our faces and feedback. But trust me, you would want to see mine today. But I do appreciate it so much, and thank you very much to all of you.
Thanks, Catherine. I appreciate that. And yeah, it's hard for everybody to not be able to sit in a room and see people's faces and read expressions and more naturally ask questions, both for on the prisoner side and the people sitting there too. So again, thank you guys for being with us today on that. We appreciate your time as well. Anyone else?
Well, until next time, I'm looking forward to our next presentation. And again, I'm available if you have any questions.
Thank you, Jen, and thank you, community leaders. Stay cool out there this week, or just don't go outside if you can. And we'll see you, some of you guys next week, and then again as a group on August 16th. All right, bye.